So as I mentioned, BPDCN, our field, is growing rapidly, which is great for our patients and caregivers. And after the approval of the tagraxofusp, the CD123 targeted therapy field has opened up. And so I'm very pleased to be a part of and leading the IMGN632 or Pivekimab sunirine trial, which has slots not only for relapsed refractory patients with BPDCN, but also for frontline. And this so-called CADENZA study is ongoing. We're enrolling patients in the United States, across Europe. And again, the goal is to understand CD123 targeted therapy in patients with BPDCN. The trial has also been investigated in patients with relapsed refractory AML. And so this target of CD123 has really opened the door to a novel investigation and pathway for our patients, hopefully giving patients more options in the future.